Yes, some few minutes ago, we dey talk say Dr. Bat good day inside the building with us for this program wey we dey call Health Matta. Definitely health shekoko and a very important thing because health na wealth safe as we both take talk am. So wonderful sir today, top of the moment to you all anywhere where you dey watch us. My name is Never China, still Chief Olododo. Alongside with me, Dr. Bartholomew Fogbolam, the MD CEO for inside Grace Valley Medical Center. Good morning, sir.
Good morning, sir. Chief.
Well done, sir. How is everything, sir?
I'm glad to be back.
Yes, sir.
Good morning, viewers at home and around the world. We're happy to be back today, and we'll be looking at the topic we started several months ago. I can't believe it's now 7 months since we started dealing with this coronavirus pandemic. This morning, we want to just remind ourselves of what we may already know, and as well as update us with what is new and what we're expected to do considering the new normal that we have found ourselves in. Yes, it is true that the lockdown, most of the places that were locked down are beginning to ease up now. Businesses are beginning to reopen. Just yesterday, the incident commander of Lagos State, talking about the governor of Lagos State, His Excellency Sanwo-Olu, he elaborated a number of things that we expect to see in the coming weeks to months. School will soon restart again for certain categories of students. What are we expected to know? What do we need to do concerning our children that will soon be returning back to classes, especially those ones that are transiting from one class to the other? What about our elderly in the society? The vulnerable, the people who have coexisting medical conditions. What can they do? NCDC recently released a guideline or a protocol or advisory for this group of people in our population, talking about the vulnerables, the aged, the elderly, and of course, the people who have pre-existing medical conditions. These and many more we'll be looking at in today's program. But just to remind ourselves of all the things we already know about this coronavirus pandemic, coronavirus is a new strain of virus named COVID-19. It's caused by SARS-CoV-2. It emanated or started in China. But today, that is no longer in the news because it has ravaged and cut across virtually all the countries of the world. And as we speak today, the world has gone past the 11 million mark. The number of people that have been affected on a global scale is currently 11,191,810 persons have been afflicted by this contagion. Among these figures, over 500,000, specifically 529,127 human beings have died as a result of complications arising from this COVID-19. Suffice also to say that over 6 million people have actually recovered from the disease as well. That's a cheering news. 6,330,820 individuals have survived this contagion. Now, what do we need to know? Number one, we have said that coronavirus is a type of virus, is a new strain of virus that is caused by a virus that was named SARS-CoV-2. And the name of the disease is today called COVID-19. What are the presenting symptoms? We have a number of symptoms that we now know that are associated with this disease. The major symptoms among them, we have said that countless number of times, are number one, fever. Number two, dry cough. Number three, breathing difficulties. Apart from fever, dry cough, and breathing difficulties, individuals that have this condition may also present with diarrhea. They may present with weakness. They may present with new loss of sense of smell or taste. It's said to be one of the diagnostic features that one should look out for if you're talking about symptoms for this disease. We can see a number of infographics scrolling up on our TV, on our screen at the moment. Okay, so you have diarrhea, you have sore throat, as well as other symptoms. Now, how are these diseases transmitted from one individual to the other. Two major routes of transmission, I must also point that out. Number one is through respiratory droplets that can emerge or can emanate from us when we are speaking, when we are singing, when we are coughing, and when we are shouting. Okay? The second route of transmission is via contaminated surfaces in a situation where somebody who is infected probably sneezed or coughed in an enclosed area. Some of the droplets that have been released may land on some hard surfaces, especially those ones that are frequently touched, like the doorknobs or handles. When an individual who is uninfected ends up touching such an area that has been contaminated and unknowingly touches his or her eyes, such a person could be infected with this COVID-19. And we have been told, yes, we can see on the screen too, how is it diagnosed? The major route of diagnosis is through laboratory investigation. Usually, it can be diagnosed in two ways. It can be diagnosed with taking a sample, a swab sample, okay, from the nasal or from the buccal cavity. It can also be diagnosed by the use of blood samples. The number of testing modalities that are currently available to the world today, top on the list and the most preferred is the so-called PCR testing, polymerase chain reaction testing method, appears to be the most trusted of them all. Antibody tests with blood have also been popular in a number of places, but they all have their strong points as well as their weak points. For antibody tests, for instance, it's being said that when one tests positive to coronavirus with an antibody testing mechanism, it tells you, it does not tell you if such a person has an active disease. It tells you that the person may have been previously exposed to the virus. The person may have it, but it does not specify if the person has an active disease. And of course, that is why the government has been hammering that people should be careful with whatever method of testing. For now in Nigeria, the most and the only acceptable, the most trusted and the only acceptable method of screening is through the one that is done in government centers, majorly through the PCR that we talked about and the ones that are currently being done through the GeneXpert machines that we recently converted. And we also have a number of good news that are coming our way. Last week, we talked about the discovery of a drug that has actually made a landmark in the treatment of people who are infected with this disease. And we also pointed out that these drugs are not for anybody to consume, because people who have little or no symptoms that may want to do self-medication may actually get into trouble doing so. And I want to reiterate what I said about it last week. Now, if you have little or no symptoms and you get to know that you're infected, the drug we're talking about is dexamethasone. That drug is not meant for you, okay? At the beginning of the infective period, your body system will make an attempt to mount an immune response to fight off the infection, okay? Now, taking such drug cannot be your friend at that stage, okay? Now, your body system is making an effort to mount a response to actually see if it could clear off the virus from your system. If you end up taking such drug, what you do is that you will restrain your immune system from acting. You dampen the action of your immune system, and of course, the virus will have a field day. That is why it's dangerous for someone to self-medicate, okay? Now, that drug will benefit people who are critically ill. And this set of people that are said to be critically ill, there are two major groups among them. People who depend on supplemental oxygen, that's group one. Group two are for people who are mechanical ventilators. Usually when one comes down with the disease, it could get to a level that breathing difficulties will become the most prominent symptom as a result of ongoing damages that such a person could have in the lungs. Okay, so at a point in time, people like that are critically ill may benefit from oxygen supplementation. This set of people, when these drugs are used for them, it can reduce the death rate among them by 1/5. Okay, but people who are on ventilators, okay, it has the capacity to reduce death rate among this set of group by 1/3. That is the benefit of such a drug. I also want to point out There's also another array, another ray of light from the horizon coming from the information we are getting from WHO with respect to vaccine. Over 200 vaccine candidates are in the making at the moment among researchers that develop vaccines. And one or two of them are said to have gotten to an advanced stage. So in some few months from now, the world may be able to have a vaccine for this COVID-19. So these are some of the things that can gladden our heart. It's not all doom and gloom. I also would like to say that the infections are yet to abate. The rate of transmission is ongoing, and that is why we need to dwell more on what you and I need to do to stay protected, to ensure that the vulnerable group of people around our family, around our homes, around our communities are protected. And these are some of the things that we look into as we go into the program proper today. Thank you very much.
Okay, thank you very much, Dr. Bat, for that lovely, well-delivered lecture on COVID-19 vis-a-vis the means at which we can do the test, which kind of tests they are available now, which one even be the best or the most preferable in the enlightening us. Even government self, that they educate us and they sensitize us. They don't just jump into any hospital, say I want to do tests. Tell us what we do. If you just join us, most definitely, if we come back from this break, Dr. Bat will still dwell more on top COVID-19, the signs, how we prevent them, and how we stay safe. So please, go nowhere. We will be right back.
Health matter na serious matter o. That na why we dey always get Dr. Bat Ufegbunam every Saturday to come teach us and enlighten us on top with health matter. You fit also advertise your product and services on top with show wey dey help people. Terms and conditions apply sha o.
Hello, today I'd like to talk to you about how to wear a non-medical mask, also known as fabric mask. Fabric masks can be used by the general public in areas where there are many people infected with COVID-19 in the community and physical distancing of at least 1 meter cannot be achieved. There are a wide variety of fabric masks that can be handmade or purchased in a store. They act as a barrier so that you can protect those around you. They should ideally be made of 3 layers of fabric. The outer layer should be a water-resistant fabric. The inner layer should be water-absorbent, and the mid-layer acts as a filter. First, clean your hands with alcohol-based hand rub or soap and water. Pick up your clean mask and inspect it. If it is damaged or dirty, do not wear it. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Do not touch the mask while wearing it to avoid contamination. If you accidentally do, clean your hands. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. As you remove the mask, lean forward slightly and remove the loops from behind the ears without touching the front of the mask. And don't forget, wash your hands after taking off the mask. Make sure that you have your own mask and do not share it with anyone. If your fabric mask is not soiled or wet and you need to reuse it, you can store it in a clean plastic resealable bag such as this one. However, if it is dirty, do not use it. Wash it with soap and water, preferably at high temperatures after each day of use. Remember, a mask alone cannot protect you from COVID-19. It must be combined with protective measures, including maintaining at least 1 meter distance from others and washing your hands frequently. Stay safe and help prevent the spread of COVID-19. Medical masks should be worn by health workers and those caring for someone with COVID-19 symptoms, persons aged 60 and over, and anyone with pre-existing medical conditions, as they are at greater risk of developing serious illness, and people who have symptoms suggestive of COVID-19. Before touching the mask, clean your hands with alcohol-based hand rub or soap and water. Inspect the mask for tears or holes. Do not use a mask that has previously been worn or is damaged. Verify which side is the top. This is usually where the metal strip is. Identify the inside of the mask, which is usually the white side. Place the mask on your face, covering your nose, mouth, and chin, making sure there are no gaps between your face and the mask. Pinch the metal strip so that it molds to the shape of your nose. Remember, do not touch the front of the mask while using it to avoid contamination. If you accidentally touch it, clean your hands. Now, how do you take off a medical mask? Before touching the mask, once again, ensure that you clean your hands with alcohol-based hand rub or soap and water. Remove the straps from behind the head or ears without touching the front of the mask. As you remove the mask, lean forward and pull the mask away from your face. Medical masks are for single use only. Discard the mask immediately, preferably into a closed bin. Clean your hands after touching the mask. Always be aware of the condition of the mask. Replace it if it gets soiled or damp. A mask alone cannot protect you from COVID-19. It must be combined with other measures, including maintaining at least 1 meter distance from each other, washing your hands frequently, and avoid touching your eyes, mouth, and nose while wearing a mask. Stay safe and help prevent the spread of COVID-19.
Well, yeah, welcome back to the show, our esteemed viewers. It could make a let on know, say, John Hopkins University, from their own latest research, they've been sure, say, 2.8 million at the moment. They don't test for COVID-19 inside the US, possibly carriers. So, some other data there, we I know say Dr. Bat to go on take relate with us. So now that premise I come there and say must we wait until our own self reach 2.8 million people will get COVID-19? Must we wait? What are the things that we can do so that we go down, we go flatten the curves? Because as we still speak, Dr. Bat still let me realize they see South Africa self, if like say the thing don't they spread well for that side. And before we go far, it good make I let you know in a participatory show, that is you go talk, we go talk. Phone lines definitely are open now. Please, our phone lines are open. Call in, reduce the volume way on top of your TV set so that you and we go enjoy the communication. First and foremost, Dr. Bat, I get 2-3 questions for you, but let me start with this. How, Dr. Bat, I mean, how possible and affordable is it for us to know our immune system level? The question now is it possible for me now to go in the hospital and say, I want to know my immune system level? That is the kind of immunity, I want to know the level. Why? Because we know, say, this thing, now immunity, now you dey follow drag. Give your immunity, dey kakraka, tendency they say if you know doing yaga. So how possible it is for me to know my immune system so that if I test and my immune system low, sir, I go know say I need to be very careful. How possible is it to know my immune, and how much is it affordable, sir? We know talks they make you give us price, because I know say you no go give us the price. But how affordable is it, sir?
Thank you very much for that very important question. Well, I must also start by saying that the immunity, there is no one singular test that anybody can do to check the person's immunity. However, there are health checks that can be done for all individuals. Now, those health checks that can be done will enable you to discover if you're diabetic, if you're hypertensive or not, or if you have any other cardiovascular illness that you may not know, because some of them actually do not show symptoms. A good example is hypertension. It's called a silent killer because a good number of people that are hypertensive may not even know they have, and they could be happy that after all I don't go to the hospital, without knowing that the person may have a pre-existing medical condition. Okay, so it's important we know so that when we are talking about pre-existing medical condition, that it actually puts us at a higher risk. It actually makes us disadvantageous alongside every other person in the population. That is what we are talking about.
Okay, Dr. Bat, what is the latest we have concerning testing in Nigeria?
Thank you very much. Let me start by going back to the figure you quoted from Johns Hopkins University. That's actually the daily, the single day tally. As a matter of fact, let me give the precise figure from Johns Hopkins University. In the last 24 hours, US recorded 57,683 new COVID cases. This record is credited to Johns Hopkins University. 57,683 new cases of COVID. As a matter of fact, in the last 3 days, they've had figures that were above 50,000, talking about 50,000 per day in the last 3 days. That is in the US. Coming back to Nigeria, we also know that at the 1st of July, Nigeria recorded 790 new cases, which of course stands today as our highest daily tally that we have seen. And now, of course, 2nd of July, we have 626 new cases. And as of over the night, we also recorded 454 new cases. And with that, that brings the total confirmed cases we have in Nigeria to 27,564. It's being shown on our screen. Good enough, 11,069 persons have been treated and discharged, and we're happy to announce this. Unfortunately, 628 people could not make it. So we need to be conversant with what is going on in our environment. Now, talking about testing, I must also point out that we need to give due credit to our government, both the federal and state government. Now, I say this because I'm a healthcare practitioner. I knew we started from a scratch. Talking about testing, Nigeria practically started from a scratch. And as of today, as we speak now, we are beginning to match up. We did a catch-up, which we are still doing. We are beginning to match up with what are obtainable in some other African countries. So we must give credit to those people who are at helm of affairs in Nigeria. Talking about the Federal Ministry of Health, the PTF of COVID-19, ably led by Mr. Boss Mustafa, the AGF of the Federation, talking about the wonderful work some state governors are doing. Top on the list is our incident commander in Lagos State, His Excellency Sanwo-Olu. He has done a magnificent job. As we speak now, we have about 47 molecular laboratories in Nigeria that can independently test for COVID-19. And as at the time we started, we had about 2 or 3. At about the time the pandemic came to Nigeria, we had about 2 to 3, but today we have about 47. We have 40, and Lagos State has just added 7 additional private labs that can actually test for COVID-19. And just yesterday, I listened to the briefing by the Lagos State governor. He actually said that there are 2 categories of people who should go for tests. Now, for the first category of people are people who fit into the case definition. Okay, these are people who have some set of symptoms, who have had contact with an confirmed infected COVID-19 patient. Now, for this set of people, they will have their tests done free of charge. Now, the second category of people are people who may require to have a COVID test done as a result of a requirement from organization or a statutory requirement in terms of people who probably want to travel and they demand that they should test for such. This set of people are expected to visit the private labs and get their tests done. for a fee, which Lagos government, state government has actually said that they are going to monitor. So I think we have made a lot of giant strides. We must give ourselves some kudos, okay? I try to look at some other African countries with respect to the number of tests they've done and all whatnot. In fact, let me even give a global view of the standing in terms of the number of tests that have been done across the world. Of course, number one still remains China. They've done over 90 million tests. 90 million tests. That's a large number. Okay, second to them is US. US so far has tested 36,297,195 persons. So that's about approximately 37 million tests. Now, when you come to African sub-region, of course, we know that South Africa is actually leading the pack. So far, South Africa has done over 1.7 million tests. Okay? Of course, next to South Africa in terms of worst hit, in terms of how affected the country is Egypt.
Sorry, sir. Let's take John. Please, let's hold you a bit. John, good morning.
Good morning, WAP TV.
How is Lagos this morning? Oh?
Fine.
Okay, sir. Go on with your question.
Okay, my question is this issue of reopening of schools. Why haven't they opened churches and mosques? Since the same thing they said the students should be doing, why won't they also open schools and mosques and churches now? Since they have made wearing of masks, mandatory, and washing of hands, and social distancing, it can also be applicable in churches and mosques.
Okay, thank you very much, John. Your question is rightly noted, and I know the doctor will react to it after this data presentation.
Yeah, thank you very much. Now, let me address the question. We'll come back to the data. Now, if you look at the opening of school, at least let's take Lagos State as a case study. The school, the information that the governor gave is that some categories of classes, usually he actually said the ones that are transiting from one class to the other, meaning that they have a time-bound examination that they must go for. People who are writing common entrance to transit from primary school to secondary school, people who are doing, yes, just 3, as well as people who will be writing WAEC, and of course, Tech 3 students as well. These are the category of students that will come in at this time. Now, the essence why I feel that government is trying to do this is to do it in such a gradual way so that the school will put in place some measures that can reduce the risk of transmission. Okay, now, you're also asking questions, why are the churches not opening? We have Adams from Kogi.
Good morning, Adams. No. How are you doing, Adams?
Fine.
Okay, go ahead with your question. The doctor is here. Yes. We can hear you, Adams. Hello, Adams.
Hello.
Yes, we're with you, sir.
Yes, please, I want to ask, who and who that have coronavirus in Lagos? I didn't know, but we never see any person that have it.
Okay, thank you. Noted.
Thank you very much. Adams, I honestly don't know where to start answering your questions, okay, because some notable Nigerians have actually come out to say that they have suffered from coronavirus. But I will just mention a name I think you should know, okay? P-Square firm, Mr. P, has actually come to announce that he was stricken alongside his family members, and as well as his domestic staff. And thankfully, they have all survived. They made it. Okay? Atiku Abubakar, our ex-vice president too, the son was afflicted at a time. And we also know he made it. Okay? A number of other people too, a number of state governors have been afflicted. Okay? Currently, I think about 2 or more state governors have been afflicted. Let me mention notable names that you can remember. Yes, His Excellency, the governor of Ondo State, has been afflicted with the virus. Also, Delta State Governor, alongside 1 or 2 of his family members too, have equally been afflicted by the virus. And we also know...
lost our former SSG.
Yes. And we also know a number of Nigerians too who died as a result of COVID-19. Let's not remind their family and relations by mentioning their names on air. So I don't think any Nigerian should be asking this question at this time. But however, we will take your questions as they come in. Thank you very much. So these are Nigerians that have been so afflicted.
Okay.
Alimat, from
Halima,
Kaduna.
good morning.
Hello, good morning.
Yeah,
How you
good
dey? How
morning.
is Kaduna?
Fine, Kaduna is great.
Okay, so Dr. Bat dey here.
Yeah, like the other caller that just dropped now. It's not people are saying prominent people don't have corona. But we are having millions of cases, but we don't know who and who has. At least we the masses are supposed to, we don't even know where our isolation center is. We are not saying there is no corona. There is, but we want the evidence.
Thank you very much. I also want to believe that the government authorities are listening to some of those questions as well as the answers. Lagos State, for example, has a number of isolation centers, and their locations are known to a good number of us. Okay, just recently, about some few days ago, COCAVID, which is a consortium of private corporate organizations, donated a 150-bedded isolation center to the pool that Lagos State has at the moment. But that said, I do know, as somebody who is in the medical profession, that those isolation centers are just like a drop in an ocean, okay? They will not be able to accommodate all the infected people or persons in our environment. That accounts for the reason why government is trying to be ingenious. They're trying to find a way to differentiate from people who are mildly afflicted to people who are severely afflicted. Those ones that are mildly, that have little or no infection, that have mild disease, can be managed at home, just like it's done in other countries of the world. Because I can tell you that the challenges, the stakes are high. No country, not even a single one country that can say in the whole world that they've been able to handle the COVID-19. Even China, yes, we can say they may have some degree of they've recorded some degree of success in their fight against COVID, but they still have sporadic outbreaks here and there. Occasionally, they will isolate a particular location. Okay, so the battle is ongoing. I think what we need to do at this time, number one, to obey the government directives that are being given to us on daily basis. We hear about them on our television sets, we read about them on social media, which is the three most important intervention is wash your hands, maintain social distancing, and of course, use a face mask.
Sorry, sir, we have Rabba. Good morning, Rabba.
Good morning, sir.
Hi, Star Rabba.
Taraba is fine, we thank God.
Yeah, please go ahead with your question. The doctor is here.
Yes, sir. Sir, you made mention of we have a number of labs that can go on with our testing. But you did not tell us that this state have this number or this state have this number. Because in my own state, I'm not sure, and I'm sure that there's no any lab. And then you are counting for the whole nation. The lab can be in Abuja or Lagos. What about Taraba and other parts of the state? That's my own question.
Okay,
Thank you very much for that wonderful observation. Thank you very much. Let me say this. It's a gradual process. Remember, I said at the beginning that Nigeria basically started from a scratch, talking about the infrastructures, the health infrastructures that we have on ground. Yes, we more or less started from a scratch. And I do know that government has a target of at least citing molecular laboratories in all the states of the Federation.
Because there's no governor that is not concerned.
Yes,
affected
in
now.
all the states of the Federation. I also do know that there are about 400 gene express machines in the country that are today being converted. Now, the good news is that with the gene express machine that is coming into the picture at the moment, the degree of time it takes to conduct a test and get a result is going to be shortened aggressively. I understand that gene expert machines can actually give a result within a space of 1 or 2 hours. And government is trying to cite about 2 in Abuja at the moment.
Okay, OJ, good morning.
Yeah, good morning, Doc.
Yeah, good morning, my brother.
Yeah, I can hear you loud and clear.
Thank
So
you
you have
very
to
much.
go on with your question.
I appreciate the program, and I just want to contribute my own observation to this COVID-19 issue. Are you hearing me?
With you, sir.
Loud and clear, sir.
Yeah. So this issue of COVID-19, we need to the observation of the rules and regulation is not being carried out in totality, because if you go to most of these states where they said the driver, most of like the case of drivers, they are taxi or whatever, they carry above the stipulated number that the government said they should carry because of this COVID-19. And let me take the case of Benin, to be precise. The taxi drivers, they carry more than like 4 at the back, sometimes 2 in the front, which is not supposed to be so.
Sad.
And we are handicapped because of the government insensibility to even increase the fuel price. That one wasn't the whole issue now. The drivers will not tell you, do not want to buy fuel and the rest things. So how do you argue that issue now? And again, those who are supposed to monitor the government order are not helping issues like the police and the rest things. Instead of them to say, look, you are not wearing face cap.
Thank you very, very much for that contribution. Thank you very, very much for that contribution. What he has said is just the truth. The degree, the level of compliance is still one of the things that are giving government, that are giving people in government, people that are in positions of authority, headache. All of us are feeling it. We are not complying with government directive, and it is not good enough. Okay? Now that we are beginning to have a number of places reopened, businesses reopened, schools gradually getting to reopen in stages, it behoves on all of us. It's a collective responsibility. We all need to encourage each other. If you're seated in a bus, if you're seated in a keke tricycle, and the next person by you that is seated around you is not putting on his or her face mask and is putting it wrongly under the chin above the forehead, call the person's attention. Please, kindly put on your face mask properly. You will endanger our lives, okay? Because with the knowledge of having asymptomatic carriers, pre-symptomatic carriers, you can actually not tell who around you has infection and who does not have. So we need to take personal responsibility to it. Don't wait for the government or for the police to stop you and get you arrested before you do it. If you're seated, you're in the supermarket, you're in a shopping mall, and you have somebody close to you who is not putting his or her face mask properly, call the person's attention and politely tell the person. I'm not sure the person will fight you if you politely tell the person. Like so politely. Your manner of addressing the person will actually determine the type of response such a person that you could elicit in such a scenario. So we need to take responsibility on individual levels. I can tell you that I do hear of people, usually when they are boarding at a park, they will ask everybody, where is your face mask? They make sure that everybody has his or her face mask. Yes. Once they're inside the vehicle, everybody pulls it down, raises it above some of them will raise above the forehead, bring it down, lower down the chin. Once the keke driver or the bus driver sees a police checkpoint that he will announce, as police, so please put up nonsense. Must we continue this way? We're endangering our lives. We don't have to be pursued. We don't have to be coerced to do the right thing. Major interventions, maintain physical or social distance of at least 2 meters, 6 feet. You can count that. 2 hands are stretched from each other, okay? That's number 1. Number 2, regular hand washing under running water with soap. Number 3, wearing of face mask, very important. Government has made it mandatory. We should not lose sight of these steps. These are critical steps that can help to save us when these places are fully open, when the churches are fully open, when the mosques are fully open, where we need to sing and shout and raise our voices. We can infect a whole lot if these measures are not put in place. Thank you very much.
Okay, thank you very much, Dr. Bartholomew Fegulam, for this lovely one. We'll see you again next time.
Yes.
Next week. Bye-bye.
Yeah, bye-bye. Credit to Johns Hopkins University for the materials we used.